Do you remember when you were younger? When you would frequent the park and the playground to socialize and interact with your peers? To see who could be the king of the monkey bars and who could go down the slide the fastest? As children, we never thought about exercise in an analytical way. We simply had an excess of energy that we needed to release, and we did so by running, jumping, playing, and the list goes on. As we age, and as we mature, we actually have to perform exercise in order to maintain our health. Skeletal muscle mass is one of the main indicators of good health. Physical strength, stamina, and balance all depend to some extent on the integrated function of skeletal muscle tissue. After reaching a peak in early adult years, skeletal muscle mass gradually begins to decline after the age of 45. This phenomenon is referred to as sarcopenia. Sarcopenia has been defined as an age-related involuntary loss of skeletal muscle mass and strength. The cause of sarcopenia is generally thought to be multifactorial, with many environmental and molecular factors at play. Environmental causes are usually divided between declines in activity and declines in nutritional intake. Older adults are less active, in part because of the increased chronic disease burden that leads to pain and fatigue. In addition, declines in adequate protein and calorie intake, as well as overnutrition that results in sarcopenic obesity and accelerated loss of muscle mass and function, are important contributors to sarcopenia in older adults. In a recent study by Jansen et al., they found that the prevalence of sarcopenia was about twice as great in the older persons who were inactive as in the older persons who were at least moderately active 3 times per week. Taken together, these results suggest that reductions in skeletal muscle mass with aging do not cause functional impairment and disability. However, if muscle loss progresses to the point where skeletal muscle mass relative to body weight is 30% below the mean of young adults, there is an increased likelihood that functional abilities will be compromised. Because it is clear that increasing physical activity should be a fundamental treatment goal, resistance exercise is particularly beneficial because it can attenuate or reverse the age-associated decrease in muscle mass and strength. The American College of Sports Medicine recommends that older adults perform 1 to 3 sets of 10 to 15 repetitions 2 to 3 days a week for all of the major muscle groups to enhance muscular strength, endurance, and size.